Hi folks, I'm Dr. Ed Beyer. Today we're talking about what are the underlying causes to ADD and ADHD. First of all, it's a neurological problem. If you've been to my workshop, you already know that. And second of all, it's multifactorial. There's many things that contribute to the area of the brain that allows a child or us to focus and to put out impulses and to act appropriately. Today we're going to talk about one of them, and we're talking about what's called primitive reflexes. These are reflexes that we are all born with that help us thrive and survive as a newborn. Okay, for example, if you take you stroke a baby's cheek on the right side, if they're under a year of age, they're going to turn. That helps the baby to latch on the mother's breast. If you stroke a baby's hand, they're going to grab it. That's a reflex, okay? One of the reflexes that we're going to talk about today that we see in a lot of our children here in the clinic is a spinal Gallant reflex. I'm going to show you what this reflex looks like, and I'm going to show you what it shouldn't look like, okay? So let's go ahead. We have a demonstration right here. So now, this is what should happen in a child over the age of 1. When you take something and you stroke the spine, nothing should move, okay? Now, if they have a persistent spinal Gallant reflex, this is what's going to happen. They're going to move away from the stroking. Okay, thank you. And so, if you do that in a 1-year-old or younger, that's a normal. The movement is normal. Over a year, it's not normal. That's a reflex that should have been remediated or gone away with after the age of 1. If you have a persistent spinal Gallant reflex, in other words, if you stroke the spine in a child over the age of 1, that is a problem. That is going to impede the development of the frontal lobes, and it's associated with poor focus. So a positive or persistent spinal Gallant reflex is poor focus. Fidgeting, because these children don't like things touching their back, so they're not going to want to sit down or have clothes on them because they have that persistent reflex. Bedwetting, it's associated with bedwetting because when you don't develop the frontal lobes, the ability to hold your bladder is diminished, or even urinating a lot during the day. Poor posture and scoliosis. These are all the things that are associated with a persistent spinal Gallant reflex. Again, we're born with these primitive reflexes because they serve us as a child. This spinal Gallant reflex is there so that we move a lot as a baby, and that helps develop our brain. But it should go away after the age of 1. When children come to us with ADD and ADHD, we check for this, and we make sure that if they have it, the first thing we got to do is get rid of it, and that's what we do with our program. I hope that helps. I'm Dr. Ed Beyer. Have a great day.